Hi, we are Group 228 and we have been assigned the topic mumps. Our group members are Adna, Kaylee, Monica, Angela, Bronte and myself, Michael. So what is mumps and what causes it? Mumps is a virus that is caused from a single-stranded RNA and is a contagious disease in which humans are a natural host. The virus can become airborne and also transmitted through direct contact with an infected person's bodily fluids or through droplet infection, meaning that an infected person who is exhaling, sneezing, or coughing may release pathogens in the liquid particles in which other people can come into contact with and contract the virus. Once infected, the virus can travel through the upper respiratory tract and multiply. Within 7 to 9 days of this process occurring, other parts of the organ can become infected. Mumps can appear as both symptomatic and asymptomatic. Asymptomatic meaning that there can be no symptoms at all. However, when there are symptoms manifesting, it is often non-specific, such as a low-grade fever, malaise, headaches, and sometimes anorexia. There is also a manifestation that reveals tenderness of the parotid gland located below and in front of your ear canal. It should be noted that when parotitis does show up as a symptom, it is usually seen 16 to 18 days after the initial infection of mumps has already occurred, with most of the infectious period being several days before and after the onset of parotitis. Although it can affect adolescents and adults, it is known as a prevalent childhood illness which is more common globally where immunization is either not implemented or introduced at all. In most cases with children, symptoms can be mild, and 1/3 of cases in prepubescent children has remained subclinical and illness is benign. However, that does not rule out that this disease can cause hospitalizations in some cases. So what are the worst possible outcomes? Orchitis and orphoritis, the inflammation of the testicles and ovaries respectively, can occur in men and women, with infertility being a rare and controversial issue. Permanent unilateral deafness can also occur, although it is very rare, and in some encephalitis cases, the worst possible outcome can lead to death. What is the best possible outcomes? Before the introduction of vaccines, mumps causing symptomatic aseptic meningitis, an inflammation of the tissues covering the brain and spinal cord, often resolved without any aftermath effects within 3 to 10 days. Furthermore, during the era of pre-vaccination, pancreatitis and the hyperglycemia associated with it was short-lasting and reversible. So what treatments are available? There are currently no antiviral treatments for mumps or vaccines that are particularly focused on mumps prevention in Australia. Therefore, there are only ways to relieve and reduce the symptoms from mumps. Saltwater gargling, as well as the use of aspirin, can assist with some of the symptoms such as headaches. A more efficient and cost-effective approach to mumps is by use of vaccinations. Vaccines are more cost-effective than treating the symptoms, as it is free of charge in Australia if the child vaccinated follows the recommended schedule. Some of the vaccines available incorporate the prevention of other disease, since there is no one particular focused on mumps alone. MMR is one such vaccine. It incorporates mumps, measles, and rubella, whereas MMRV incorporates varicella as well. For children, the newest recommended vaccination schedule is 2 doses, 1 MMR vaccine during 12 months of age and 1 MMRV vaccine at approximately 18 months of age. It is not recommended to use MMRV vaccine as the first dose as it increases the risk of fever and seizures, especially administered before 1 year of age. For adults, it's best to take a serology test for mumps to confirm immunity. 2 doses of vaccines for mumps is recommended if you are not immune, with each dose at least 4 weeks apart from each other. So what is the best approach? Since there are no current treatments of the virus itself, isolation of infected people from the public for at least 5 days is advised due to the virus being highly active within that time period. Based upon the research, we recommend that preventative methods are the most cost-effective and efficient way to avoid mumps. We recommend this method as cost-effective due to it being free of charge, and it is efficient because it is 88% effective when administered in the correct time frame. This would help avoid the complications of the virus. It is suggested that you seek a general practitioner to schedule your vaccination, as well as ask any questions you may have about the mumps virus. From all of us at Group 228, thank you very much for listening.